Hello everyone, I'm Dr. Mohan Kumar V, consultant physician and ECP consultant at Revive Hospital, Mysore. Welcome to another episode of ECP therapy. Now, today we have an interesting person, Mr. Vijay Chawla. He is aged around 52 years. So, he has a strong family history of coronary artery disease. Both parents died of heart attack. Of course, he is a diabetic for the last 15 years. So, what is very interesting about Mr. Vijay Chawla is he has taken ECP therapy as a primary prevention of coronary artery disease. Either it or untouched territory. Most of our patients, what we have been treating, almost 700 to 800 patients we have treated, they're all taking ECP therapy as a secondary therapeutic module. In the sense, they would have had a heart attack or something else. They would have had a stent in place. Somebody had a failed bypass surgery. For those patients, we are giving ECP therapy. Here we have Mr. Chawla, who has undergone ECP therapy as a primary preventive module for preventing coronary artery disease. So let us try to understand what was his experience, why did he choose ECP therapy? So what was his idea behind choosing ECP therapy for primary prevention of coronary artery disease?
Thank you, doctor, for having me. Importantly, the reason I went for the ECP therapy was because this was what I understood from you and a little bit of reading was this was the only non-invasive option that was available. Because generally you wait for the symptoms to arise in a cardiac situation, and wherein which of course you're taking a chance with the future outcome of it, right? So, and in some cases we don't have really too many even the time on our side because it's so immediate and so right now to be done. So I thought this was the only preventive option available. So that was a great thing to do. I think one doesn't need to even have second thoughts about doing it because the benefits, of course, outweigh the risks that one is waiting for.
So to be frank, the risks are absolutely negligible or almost non-existent, I believe. And when you took ECP therapy, what was in your mind? Did you look at the mechanism? How does it work? How it is going to help you like that?
Obviously, I wanted to get to know a little bit more because it was more preventive. So I had the time on my side. Of course. So and one has always second thoughts about all these new therapies. But when I went into a little bit of depth, I found that it's been in practice for a long period of time. So there was a history to it. So and when I saw there was no side effects, there was nothing. You could only gain more than what you could lose. So that was definitely one of the prime reasons that I thought, it's better late than never.
Correct. So post ECP therapy, did you feel any changes in your body?
Oh, definitely. I mean, one thing for sure is, well, I'm 52. It's not like really out there, and it's not in my mind that I'm aging in a sense, in a true sense of the word. But the fatigue that comes in along with age. And I used to have slight pain every now and then, which in typical terms we term it as gastric, at our own levels. But definitely there is something that the heart is telling you. So, after that, so all these things, the fatigue, I think it's kind of a rejuvenation for the body. I think it's overall, I became much more active. And I didn't have, till now, I've never felt any uneasiness, even a slight bit. The fatigue is gone. I can feel that the blood circulation in my body is really improved. And earlier, let's say, for instance, how like the biomarkers that we look at generally are the activity levels, climbing steps. So now I push myself to try and see how many steps I can try climb without even having a half. I think definitely it's helped me there, and that I can see it right there in front of me. So definitely a lot of changes.
Definitely, as Mr. Chawla said, definitely ECP has helped him. Not only that, he gained so much of confidence. His sister also underwent ECP therapy. So looking at the benefits of ECP therapy, we all know ECP is a USFDA approved form of treatment for improving the coronary circulation. Not only coronary circulation, if you look at the mechanism, how does it work? it improves circulation to every organ above the waist, including brain, including skin, including liver, kidneys, and lungs, and whatever the organs you name it above the waist. Definitely, there is improved circulation. So, definitely, Mr. Chawla has experienced the benefit of ECP therapy, and what he says, once in 5 years, I want to get the ECP therapy every 5 years for my well-being. So that is a level of confidence. So this is what very interesting about ECP therapy. Unfortunately, majority of the people and majority of the doctors, they don't know about ECP therapy, even though it is USFDA approved. The usage is very abysmal. So I would ask everybody to look into the benefits of ECP therapy, not only as a secondary prevention model. It can be used as a primary prevention module. With that, we have seen with Mr. Chawla's case. So not only he has undergone, his entire family has undergone ECP therapy, and they are reaping the benefits of ECP therapy. Would you like to add anything else?
Just one last point, doctor, is like you said, it is not something that even doctor community recommends, but I think it is something, because I've had a first-hand benefit of it. I would consider myself actually lucky, because there's not many places that this facility is available. There's not much of awareness, though there is some good work being done by some of the doctors. Like, if you would like me to mention, Dr. Jajjar is also there
Yes.
of Saul Clinic. He's also a great proponent of ECP.
Yes.
So I think there are people who are doing, there are great doctors who are recommending this. The fact that I went and recommended a family thing in our family itself speaks that, there's something that I believe in and something that I've had a great experience of. Hence, I'm recommending it to my family members. And I would say anybody who's either waiting or not waiting should take a chance, because should do this and not wait to take a chance with the lifestyle that we are living today. This is a better option available today. So that's the only thing.
So well said, Mr. Chawla. So as I said earlier, ECP, what does it tell you? So ECP, external cardiac counterpulsation therapy, not only it helps in improving the circulation to the heart, it improves the circulation to every part of the body. So that is the advantage. This is USFDA approved and very, very safe form of treatment. Absolutely no side effects. So we have treated till now around 800 patients. Most of the patients as a secondary prevention. Some of them have come post bypass. Again, there is a blockage. Post angioplasty, again blockage. And some of the patient triple vessel disease, they are not willing to undergo bypass surgery or angioplasty. So these are the categories of patient, but in Mr. Chawla's case, it is the other way around. He has come for a primary prevention and his entire family has undergone. So with these inputs, I would like to end my today's discussion. Thank you, everyone.